Good evening slash good night, beautiful people. On this fine Wednesday night. This week has been another doozy of a week. Except for today. Today wasn't that bad actually. Monday and Tuesday at work were a little bit ridiculous to say the least. But it kind of evened out on a nice note for tonight, and I got out at a decent hour and hit it home. Ugh. But you know, more things to come, as they always say. So I know tomorrow I have a appointment with the VA. Wound up doing a VA claim. I got out in 2015. I was fortunate enough not to get shot, blown up, or anything. I did serve during active wartime and stuff like that. But because I never got shot, blown up, or anything, I never really, I guess, tried to file like any kind of VA claims. And I got out in 2015. Honorable discharge, everything. So I never filed a VA claim or anything, and then I got home, went to college, used GI Bill to go to college, used the VA home loan program to buy my house. So for me, it was kind of like I always felt like, I got something out of it. Also, I learned discipline. I learned what it was to, in my opinion, be a man and take care of what needed to be taken care of, and a lot of the same principles that I learned from the Army and the military in general, I still keep to this day. Trying to keep a professional appearance, not looking sloppy, disheveled, and keeping. Jokingly, I always say, when I'm teaching someone or when I'm doing anything, I always remember the 3 S's, which is short, simple, stupid. It was something that I learned in the Army, which is you want to keep anything that you're teaching short and to the point. You want to keep it simple. Don't use exaggerated words or anything. Just keep it simple. And then you want to make it to where the stupidest person in the world can understand and do it. Short, simple, stupid. So keep it short. Make sure your instructions are simple, and make it so the stupidest person in the world can figure it out and do it. Short, simple, stupid. And I still to this day try to break things down into short, simple, stupid terms. There's a few other things, but that's the main one that I feel like I'm using the most in this part of my life. So I feel like I got a lot out of the military. I never did a VA claim. And probably about 4 months ago, I had a patient who's like a VA rep and everything, and they were just talking to me. He cued me out almost instantly that I was a veteran and was talking to me about it and asked me if I had done like a claim or anything like that. And I told him, I was like, no, I was like, I never got shot, never got blown up. I never, really had any issues other than, really kind of nothing. I was like, I have like a slight, basically like when I hear like a really loud noise near me, I'll have kind of like a certain hum for a little bit longer than probably I should, if that makes sense. And he's like, oh, well, that sounds like a form of tinnitus. That could technically qualify you for a VA disability. And then he was asking what kind of earplugs we were using during that time. And I told him, we're using the 3 M's. And he's like, oh, well, there was a big lawsuit against them. And if you were in the military during a time where they were using the 3M earplugs, then and you're having trouble with tinnitus, then you can actually might be able to get compensation for that. And then and I was like, oh, okay. I was like, that's interesting. Didn't really think nothing of it. And then the very next question he asked me, he's like, well, how do you sleep? And I was like, I sleep about 6 hours. I was like, give or take. And I was like, and I just wake up. And he's like, oh, well, when you wake up, do you kind of like wake up kind of groggy, or do you just kind of like wake up and you're up? I was like, oh no, like when I wake up, I'm up. Like it's like I might not be ready to run no 5 miles or anything, but like when roughly that 6 hour mark hits, it's like my body instantly wakes up on its own, and like I'm fully awake. Like I could wake up and carry a conversation as soon as I wake up. And he was saying that that's actually considered a form of like PTSD and stuff like that, which I never, considered it a form of PTSD or anything. And admittedly, I got out under the Obama administration, and I never got to speak with a VA rep or anything like that when I got out processed, because it was kind of like an expedited thing, because they were trying to downsize the troops and they were just expediting everybody. Usually I think people go through like a 2 to 3 month thing. Mine was like 2 weeks and I was out. But he was asking me about that. He asked me if I had to have any surgeries while I was in. And I told him I was like, yeah, like my appendix ruptured whenever I was in. I had to have a appendectomy. And, I had a bunch of dental work done and stuff like that while I was in also. And he was like, oh, yeah. He's like, you might be able to get compensation for all of those things. He's like, I don't understand why no one has told you to file a claim. So I was like, maybe I should file a claim, And he's like, yeah, just file a claim. He's like, even if you don't get a disability rating on anything, he said, you still want to file the claim. That way, 20 years from now, let's say something happens, and if they can trace it back to something that happened while you were in country or anything like that, or if it's just loosely related to it, the VA might be able to take care of that thing that happens to you, like when you become 40 or 50. He's like, for instance, like you had to have your appendix removed while you were in the military. He's like, so what's to say that, 20 years from now you realize, like let's say you have to have like a small bowel obstruction or something, which this is a very common thing. People get small bowel obstructions, and they're like, let's say you get a small bowel obstruction and it's related to the adhesions or something that happened with your appendix, like in that area where your appendix used to be, and now you're having trouble in that area, 15, 20 years from now. He's like, well, if it can be traced back to you having to have your appendix removed while you're in the military, he's like, the VA would pick up, that hospital bill and take care of it and take care of you, and it might change your disability rating, it might not. He's like, but you definitely, just want to get checked out and get seen and, have some kind of record with the VA at the very least. He's like, even if you're not going to get any disability ratings. So I was like, okay, you know what? I'm going to do it. I want to do it when I get home. Obviously, life happened. I wound up not doing it. And then it was about, not even the very next week, actually, our social worker was talking about the VA and all this stuff, and was talking to me about it, asking me if I had similar issues, because one of the patients was having some issues with the VA. And I just told her, I was like, no, I've yet to do a claim, and I've got out in 2015. It's now 2025, I was like, I mean, even if they said something, it's kind of too late. Probably they're not going to do anything because they're going to be like, well, why'd you wait 10 years kind of thing, you know? And again, she was like, no, you need to file it because if something happens, you know, kind of the same story. And I was like, you know what? Like, this has literally been two different people telling me the same thing, same conversation in a way. And she kind of asked me roughly the same questions too. And I was like, you know what? I want to do it. I want to do it when I get home this Thursday. So that Thursday rolled around, and one of my military buddies hit me up Thursday. And it was just like, hey, man, how you been doing? I was like, oh, I'm doing pretty good, you know, doing school, this, that, and the other. He's like, is the VA helping you with your school? And I was like, well, I ran out of my post 9/11, getting my bachelor's degree and stuff. I'm now doing the master's. And he's like, well, you know, if you have a disability rating or anything on file with the VA, like medically related, you can file for an extension of those benefits. And I'm like, are you serious? He's like, yeah. And I'm like, man, that is... And I kind of told him what had happened with the other two people. And he's like, man, I think the universe or God or somebody is telling you to do it. So I was like, all right. I was like, you know what? Let me get off the phone with you and let me file it. So I got off the phone with them. I filed it, and they ask you a series of questions on there. I didn't get with no representative or anything at that time. I just was like, I'm going to file it myself and see where we go. And worst case scenario, they tell me no, that I don't qualify for something, or best, you know, or kind of middle class scenario, which is I think what would probably happen, is they do say like, hey, this thing is service related, but we don't really consider you disabled, but we do recognize this thing happened, and then it gets filed. So I mean, that's kind of what I'm somewhat hoping for. I mean, if I get a disability rating and they give me a disability check through the VA, I mean, obviously I'm not gonna cry over it. I'm just gonna be like, okay, I guess. I mean, if y'all deem that I'm a certain percentage of disability because of things that happen or issues that I'm having going on, then yeah, I mean, I'll take it. But I mean, obviously I've gone this long without it, so it's not something that I'm not really one of those people that tries to play the system on it. But I got an appointment tomorrow for like a telemedicine thing on a video call for psych. So I guess that'll be the kind of the PTSD questionnaire kind of thing. And I guess my biggest concern with going through all this is I don't take any medications, and I don't really want to get started on nothing because, I mean, yeah, I have like a few, kind of like the waking up at the 6-hour mark and I'm kind of wide awake. I mean, obviously y'all have seen videos where I'm yawning, but I mean, the videos that y'all see me record at like 4:15 in the morning, like that's me literally waking up, moving to the driver's seat, headed to the gym, and I'm hitting record. Like, I'm not doing a stretch. I'm not doing anything. Like, I'm waking up and I'm already alert and everything enough to record a video and to have cognitive thought and everything on my way to the gym and everything. So, and admittedly, because I do have those kind of like that 6-hour sleep interval, a lot of times at like 2 o'clock in the afternoon, or when I used to work night shift, 2 o'clock in the morning, it's like I hit a slump where I feel like I need like a little 15 to 30 minute nap to recharge. And that's something there. Another thing, I technically am 32 and I qualified for TRT, like my testosterone's low. I've never taken testosterone except for whenever I was at basic training and they were doing all our blood work and everything like that. They gave me like a testosterone gel, because even when or not basic training but AIT, when I went to AIT and stuff and was getting ready for combat medic school, they make us do all these labs and stuff to make sure you don't have any diseases and things like that. And my testosterone was low, and they prescribed me like a testosterone gel. I used it for maybe like a month, but then the problem I had was you had to like be able to wash your hands, and you had to, do it on the inside of your groin and all this stuff, and you were supposed to clean the area real good before you applied. Then you had to wash your hands really good and everything, because if you didn't and you touched somebody else, you basically got testosterone in your hand, and it can like mess with females' hormones. And there's a lot of stuff going on with it, with the gel stuff. And we were in the field training so much that it was like it just became very hard to keep up with it and everything, to make sure, obviously when you're in the field you're not able to be super hygienic, and like there's no showers or anything usually a lot of times when you're in the field. So I wasn't able to keep up with the gel, so I just stopped using it, admittedly, and just kind of moved on with my life. Well, now fast forward, I'm 32, and I'm getting blood work, doing my annual physicals and everything, and every year they're like, for last year and this year, they're like, hey, your testosterone levels is only in the 200s, 300 to 1100 is the normal range. Technically you qualify for testosterone replacement therapy or hormone replacement therapy, or like we could send you to an endocrinologist and see if there's a reason why it's low, and like, are you having any health issues? And I'm like, well, I'm just tired, but I think that's more related to me only getting kind of 6 hours of sleep, but I don't know. And I went to a urologist to get it seen about, and they were like, oh yeah, we can start you on testosterone replacement therapy. I mean, all of your labs, your receptors are there. It's like you just don't have the free testosterone or whatever. I can't remember exactly how she worded it, but she was like, you're like an excellent candidate for it. Like, basically your body, if we gave you testosterone replacement therapy, your body would be able to absorb it and take it in, and it'd still be healthy for you, so to speak. And then my prostate antigen levels were basically like non-existent. I don't have high blood pressure. I don't have high hemoglobin, which is another issue a lot of people have when they're on testosterone replacement therapy. So it was like kind of like all my lab values were fine and conducive with me doing it. Another issue that I found when I was in the military is I had a fatty liver. That was a big reason I stopped drinking at all, was the fatty liver. I was like, no, I can't do this. I don't want to get cirrhosis or have other health issues. And so then when I started doing the VA claim, I just started really thinking about it. I'm like, dang, how much stuff do I really have going on? And they give you like this little breakdown thing where you're going through it, where you can kind of like almost like self-diagnose like issues and stuff, or things that you were seen about, like anything that you were seen about in the military while you were serving, like, and they want all that. So I'm like, well, I mean, I was seen for shin splints, I was seen for this, that, and the other, and so I'm putting the stuff, and then all of a sudden at the very end, I look up and there's this ginormous list of things, and I'm like, holy crap, am I a little bit more effed up than I thought? Because I'm sitting there thinking like, oh, okay, I'm pretty good. I'm not taking any medications. I'm not having to do all these things, and I'm like, dang, am I good? You know what I mean? Like, maybe I'm not as good as I thought I was. Is this an issue? So, to say that I'm a little nervous about doing all this VA stuff is an understatement, because it kind of, I don't know, it's when you really go back and you think about every little thing that you've had health related that you were ever seen about, or maybe issues that you have ongoing that you kind of almost like sweep under the rug, like you don't think about it. You're like, oh, that's, that lower back pain, like, that's nothing. That's just me. Everybody has lower back pain. You're just like, But then when you start looking at it, you're like, well, dang, when did that lower back pain really start? Like, oh, well, I guess, it kind of did start when I was in the Army, like doing all the ruck marches and like all the things, like, dang. And then I've never had an x-ray. I've never had a CT scan, MRI, never nothing. So I'm like, man, then you start thinking like, dang, is my back messed up somehow? Maybe, like, obviously it still functions good enough for me to get around, move around, and, kind of go to the gym, but I do have like muscle tightness back there and stuff, So, I kind of see, when I did all this, it was just stuff that popped up that I don't really think about, because I don't know, I just don't think about it. Like, I'm in the everyday cycle of life, so I don't sit there and I guess nitpick my own health history, I guess. But I basically had to, do a history and physical on myself, and when I did that, I'm like, holy crap, like, I've had, this many teeth that I had to have root canals for. I had PRK when I was in. I had my appendix taken out. After my appendix was taken out, I also found out like I had like a fatty liver deposit while I was in. Is that related to some of the nutrition, like eating MREs, or maybe it was like a side effect of a vaccine, with all the vaccine stuff that's coming out now. And then obviously when you're in the military, you get every vaccine under the sun. They line you up like cattle pretty much. Is it, was I coping with stress with alcohol, and that's how it led to the fatty liver? Since then I've pretty much quit. Is the reason I'm having the low testosterone is because I can't sleep? Is this because of this? Because, and then also with me doing my nurse practitioner, it's very easy for me to connect the dots on some of these things, because I'm like, okay, I know this can cause this. So, and I get kind of how people become hypochondriacs. And I almost kind of like felt that way. I was like, oh my gosh, I'm turning into a hypochondriac. I'm over here self-diagnosing all this crazy crap. And so it did scare me and a little bit with everything that's going on. And I'm the guy that's taking care of the family. I'm the breadwinner for the household. I'm the one that's taking care of the patients, leading the unit in the hospital, leading my household, I'm the one that is like, hey, I got it. I'll take care of it, And then now it forced me to take a step back and realize, damn, I'm not taking care of myself, And it was definitely an eye opener, and maybe that was with all those conversations about the VA and doing, the claims and everything, maybe part of, God's plan or the universe or whatever you believe in. I mean, I say God's plan because I believe in God. Maybe that was God's way of saying, like, hey, you need to take a step back and look at this. There's something coming, And, yeah, so I'm a little nervous about it. I'm not going to lie. I got the psych eval tomorrow, seeing if I'm having any, like, PTSD symptoms, which I don't really think I am. I think maybe the lack of sleep, like where I'm waking up fully alert, maybe that's got, like, some psych components to it. I really do not want to start on any psychiatric meds because I don't feel that I need them, because even though I wake up alert, I'm fully functional. Like, I'm not depressed, I'm not anxious, I'm not anything. I mean, every once in a while, I'm stressed, but in my opinion, I feel like everybody is stressed in life at some point or another. So I don't view stress as a negative as most people do, because without putting a little stress on yourself or a stress on a situation, you're never going to adapt, you're never going to change, you're never going to grow. You grow through the stress. Where they talk about, a lump of sand is pressed into a pearl. And how is it done? It's done through immense pressure over time. So it's like, okay, well, or, a coal that turns into a diamond, same thing. So I don't necessarily view stress as a negative. And I have a lot of stress in my life, but I don't feel overly stressed. Now, obviously, if you're overly stressed to the point that you are shutting down, then that's overly stressed. That's not just normal stress. That's an excess. But I feel like stress as like a certain level is healthy and is good for you, and you should find things that stress your body and your systems a little bit, and it'll make you a better person. So I don't feel like I need anything in that regard. But I'm not too concerned on that. I know I got an auditory, I had to reschedule because it conflicted with my work and travel and everything, so they're gonna get back with me on a time frame for that one. That one I'm a little bit nervous on because, like I said, there's like a certain pitch, and it's kind of random. Like it's not a constant hum or anything, or like a ringing or anything like that, like most people talk about. It's just the fact that, like, certain notes, like if I hear them, or like, it's just like it's not like a gunshot or anything like that crazy. Obviously, if you get someone shoots a gun beside your ears, they're gonna ring. It's not that. It's like a certain decibel of sound will hit, and it doesn't even have to be loud, but it'll instantly just kind of cause me to go into like a hum afterwards. Like, I'll hear the sound, and then I'll hear like, and then it only lasts for like 5-10 seconds, and then it'll be gone. So I'm like, I don't know what that's about. I'm hoping it's nothing severe. I mean, again, that's something I've been living with, and it's not constant. It's not something that kind of hinders me in a way. It's just something that's there. And the few times that it does hit me, I'll just kind of be like, okay, and I'll just sit there and stop talking and let it work itself out, and then I'll resume the conversation I'm having or whatever else is going on. I'll just kind of let it work its way out, and then I'll just keep doing what I'm doing. So nothing too horrible there. So I'm hoping they don't see like something crazy and say like, oh yeah, you got da 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 da, you need to get this and this and this to fix it. Especially if it's something surgical. If it's some kind of surgery, I'll probably pass on it for now because I feel like the risk would outweigh the reward for me personally. Because I'm still fully functional in my life right now. But again, that kind of goes back to maybe there is something going on and I don't need to get nothing done now, but maybe when I'm 40, 50 years old, it gets worse and I have to get something done, and at least now it'll be documented. So I feel like God's, kind of pointing me in that direction for a reason. I mean, 3 people, I've been out of the military for 10 years. So for 3 people in different avenues that obviously have nothing to do with each other because they don't even know each other at all, to talk to me about the same thing within 2 weeks after I've been out for 10 years, pretty much, is just a little unsettling for me. And then when I sat down and really went through, it was even more unsettling for me. So yeah, I'm a little nervous to find out what all's going on. I mean, I feel like there might be something I don't even know, some skeletons in the closet, as they say, and has got me a little nervous, to say the least. I'm hoping and praying it's nothing significant that I would need to address. I'm hoping it's just minor inconveniences like it has been for my life. But until that time comes and I have those appointments, like I said, this one tomorrow is psych. I think auditory is next, and then the last one will be the full extensive labs, yada yada yadas. I don't know if they're gonna want me to do like a CT, chest X-rays, or what they're gonna do, because I mean, this is all new to me. I don't know how this stuff works. So I don't know how the extensive one is going to go. I know that's going to be the last one, and I don't even have a date. Admittedly, I probably don't have a date because of everything going on with the shutdown right now. I'm pretty sure that's delayed some processing. But yeah, it's a scary thing, but I feel like it's something that I have to find out. I have to get through it. I'm a huge believer in knowledge is the key to success, and knowledge is the key to life. The more you know, the more you can adapt and grow. So definitely need to figure it out, figure out what the next steps are if there is something going on, something insidious, as they say. But, mentally kind of dealing with that, putting it on the back burner. I mean, I'm very busy, so it's easy for me to kind of push it to the side of my brain, and then when I'm doing these drives or going to bed at night, it might pop up for a brief second, and I'll kind of push it back again because I'm like, hey, there's nothing we can do about it right now. Like, there's no reason for me to think about this, dwell on this, because at the end of the day, nothing is happening right now. We don't know nothing right now. Just keep on doing what we're doing, So that's it's kind of my thought process on it. There's nothing going on right now. We don't know of nothing right now. So let's not stress about something we don't know nothing. Like, hell, I might go and they'll be like, hey, you're the healthiest veteran we ever seen, except for you sleep 6 hours and your testosterone's a little low and you had your appendix taken out and you got a little stress in your life. Other than that, you are 100% healthy. That's pretty much what I'm, fingers crossed, going for. And hopefully stay that way my whole life. That would be ideal. I highly doubt it as I get older. I'm sure, health issues will pop up as I get older. But We shall see. We shall see how all this will plan out. But yeah, I mean, I haven't really talked to the wife about any of this stuff. I'm one of those people I don't try to, not that I keep stuff from my wife per se, but on the stress category and, my wife is one of those people that feeds on energy, and she is a very anxious woman. So for me, if she sees that I'm upset or I'm, stressed about something, now granted, I'm a very laid back, kind of easygoing guy in general speaking, except for, certain parts. So when she sees me stressed, it's like, she's like, oh crap, if he's stressed, it must be something. And then that gets her worked up, and then, it's just an ongoing thing there. And then it, ironically, it falls back on me, throwing more stress on me. And then I got to try to push my stuff to the side to calm her down, because now she's stressed because I was stressed, which is stressing me out more. So I need to calm her down so I'll have less stress. As crazy as that paradox sounds. But she's a good woman. She takes care of me, and she makes sure I do what I'm supposed to do, because I know I talked to her about conversations I had with those people and stuff, and I thought she was going to beat me. I'm about to say another word there. Thought she was going to, beat me for not doing it, because I guess in her mind she thought I'd already done it, because it's not something, I talked about. So I guess in her mind she thought it was already a done thing, but it definitely is not. But yeah, so she was kind of upset that I hadn't already taken care of it. But it is what it is on that. I am almost to the house now, so I am going to get off of here, finish the last about 5-10 minutes of my drive, get home. I'm getting here about 30 minutes early. I got out at a wonderful time today. Usually I get out late. Today I got out pretty much right on time, and yeah, I'm actually getting home at about 9:45, which is really good for me. A lot of times I don't get home till like 11 almost. So this is a little uncanny for me. I might actually stay up and talk to the wife a little bit instead of just getting home, taking the clothes off, and passing out like I normally do. But she'll probably already be asleep because she's been dealing with the kids. But we'll see how that all unfolds. But till we have the next video, y'all let the wife and kids know you love them. Give the old lady a slap on the butt. Let her know she drives you wild. And just have a good day.